Hello everyone, this is Dr. Charishma from the Department of Pediatric and Preventive Dentistry. This presentation is about Hall's technique. Hall's technique is also called as biological technique or minimal cutting approach technique. This is one of the techniques used for the placement of stainless steel crowns in pediatric dentistry. The name was given after the scientist Dr. Norman Hall. So this technique has several advantages such as this is very quick and non-invasive, not much of tooth preparation is required. Similar to a traumatic restorative treatment, there is no need for the caries removal, there is no need for local anesthesia or rubber dam application. Because of all the above reasons, this technique is mostly acceptable to the dentist, parent and the child. Whereas the disadvantages of this technique are the untreated caries lesions which are left behind might spread into the deeper pulp tissues and can cause pulp pathology. The second disadvantage is because there is already a stainless steel crown which is placed, it becomes difficult for the retreatment in case of pulp pathology. Hence, this technique can only be used as a supplement to the conventional technique but not completely as a substitute. So, where do you use this? Various clinical situations are firstly, class 1 non-cavitated caries lesions wherein the child is unable to accept visual sealants, and class 1 cavitated caries lesions wherein the child is unable to accept caries removal and conventional restorations. And also this technique can be used in class 2 cavitated or non-cavitated lesions. In the same way, there are some situations where the Hall's technique cannot be used, such as when there are signs or symptoms of irreversible pulpitis, when there are clinical or radiographic signs of pulp exposure, in unrestorable crowns like those which are indicated for extraction, and also in patients at risk for bacterial endocarditis. Coming to the procedure, the first step in procedure is setting up the armamentarium. So, what are all the instruments which are required for the procedure? Firstly, diagnostic instruments like mouth mirror, tweezer, probe, and spoon excavator. Then, instruments for placing separators like separator placing instrument, needle holders, mosquito forceps, etc. Floss also can be used. Then, instruments which are useful for the manipulation of the stainless steel crowns like crown crimping plier, contouring plier, and straight hole plier. The other things also to be kept ready, such as cotton rolls for isolation and type 1 glass enamel cement for luting the crown, and the different sizes of the crowns need to be kept ready. Then the coming to the step 2, that is the placement of the stainless steel placement of the separators. So why do we usually place separators in primary teeth? Only when there are very tight contacts and we know when the stainless steel crown is not going to be placed. Otherwise, usually primary dentition is well spaced enough, which allows the stainless steel crown to go without any preparation. So when there are tight contacts, you can use a floss or needle forceps to allow the separator to go through, or separator placing instrument will be there, which is more convenient. So this is separator placing instrument because which we can easily place the separators in the proximal areas. So this can be placed for around 20 minutes to half an hour, which allows us to give the enough amount of time for the contact area to open. So coming to the next step, after placing the separators, after half an hour around we have to remove the separators. So how do we remove the separators? We can either use an explorer or a pointed end of the probe to remove the explorer. So here you can see, when you are removing the explorer, the important thing is you have to hold the other end with the finger so that it won't just jump into the oral cavity, and it may cause unnecessary swallowing or the aspiration in very small children. The next step is to select the proper crown size, okay, that fits the tooth correctly, the tooth mesoastally and buccolingually without any exposure of the tooth. So there are different sizes of the crowns which are available over the market. So first you have to try the crown. So you can see here there's a lot of tooth structure which is being exposed, and the crown is not going inside. So let's take the next size of the crown and then let's try. So this is the next size, E5 size. So when you see, yes, it's almost going in, properly, but this is the nearest possible size that fits the tooth. Okay, so when this kind of crowns are selected, you can slightly adjust the crown so that it is going to fit the tooth correctly. Here we are using hope layer to just flatten the mesial and distal ends of the crown, and now we are again trying in the crown. Yes, now the crown has fit correctly with no exposure. Now after trial, you just we have to remove the crown and then prepare the tooth for the luting of the crown. So how do you remove the crown? Using a spoon excavator. The same thing, the fingers need to be on the crown so that crown does not slip into the oral cavity. So after the trial of the selecting the proper size of the crown, you can just lute the crown with the type 1 low viscosity GIC. So for that, you have to mix the type 1 luting GIC in a luting consistency. Okay, and then you have to load the crown. Load the crown. While loading the crown, we have to remember that 2/3 of the crown should be filled with the luting cement. 2/3 of the crown, yes. And you have to spread the cement on all the surfaces so that it is spread evenly. Then you have to lute the crown. Before luting the crown, you can just clean the teeth with the soft caries and all. Okay, and dry the tooth. Isolate the tooth with cotton rolls. Okay, then lute the crown. After luting, you can ask the patient to bite on the cotton roll which is placed over the teeth so that this is so that the excess cement flows out, and then you can check for the occlusion. After luting the crown, you have to check for the occlusion, and then you can remove all the excess cement which is present in the interproximal areas. And thank you. Comparatively, this is an easier, simpler technique to treat initial caries lesions in uncooperative patients where crown preparation would be very difficult. So this is the Hall's technique. Thank you, one and all.